Dissociation is a disconnection between a person's thoughts, memories, feelings, actions, or sense of who he or she is. This is a normal process that everyone has experienced. Examples of mild, common dissociation include daydreaming, highway hypnosis, or getting lost in a book or a movie, all of which involve losing touch with awareness of one's immediate surroundings. During a traumatic experience, such as an accident, disaster, or crime victimization, dissociation can help a person tolerate what might otherwise be too difficult to bear. In other situations like these, a person may dissociate the memory of the place, circumstances, or feelings about the overwhelming event, mentally escaping from the fear, pain, and horror. This may make it difficult to later remember the details of the experience, as reported by many disaster and accident survivors. Dissociative identity disorder is associated with overwhelming experiences, traumatic events, and/or personal abuse that occurred in childhood. Dissociative identity disorder was previously referred to as multiple personality disorder. Some symptoms that include the existence of two or more distinct identities. The distinct identities are accompanied by changes in behavior, memory, and thinking. The signs and symptoms may be observed by others or reported by the individual themselves. Also, ongoing gaps in memory about everyday events, personal information, and/or past traumatic events are apparent. The symptoms also cause significant distress or problems in social, occupational, and/or other areas of functioning. The attitude and personal preferences of a person with dissociative identity disorder may suddenly shift and then shift back. The identities happen involuntarily and are unwanted and cause distress. People with dissociative identity disorder may feel that they have suddenly become observers of their own speech and actions, or their bodies may feel different. For people with dissociative identity disorder, the extent of problems functioning can vary widely from minimal to significant problems. People often try to minimize the impact of their symptoms. People who have experienced physical and sexual abuse in childhood are at increased risk of dissociative identity disorder. The vast majority of people who develop dissociative disorders have experienced repetitive, overwhelming trauma in their childhood. Among people with dissociative identity disorder in the United States, Canada, and Europe, about 90% had been the victims of childhood abuse and neglect. Suicide attempts and self-injurious behavior are common among people with dissociative identity disorder. More than 70% of outpatients with dissociative identity disorder have attempted suicide. With appropriate treatment, many people are successful in addressing the major symptoms of dissociative identity disorder and improving their ability to function and live a productive, fulfilling life. Treatment typically involves psychotherapy. Therapy can help people gain control over their dissociative processes and symptoms. The goal of therapy is to help interrogate the different elements of identity. Therapy may be intense and difficult as it involves remembering and coping with past traumatic experiences. Cognitive behavioral therapy and dialectical behavioral therapy are two commonly used types of therapy. Hypnosis has also been found to be helpful in treatment of dissociative identity disorder. There are no medications to directly treat the symptoms of dissociative identity disorder. However, medication may be helpful in treating related conditions or symptoms, such as the use of antidepressants to treat symptoms of depression.